Vascular surgery has actually had a very drastic evolution.
We are certainly seeing more and more innovative approaches to dealing with a large number of cardiovascular problems.
We're trying to decrease the mortality, morbidity in patients, decrease the trauma that's occurred in these patients.
In the future, and the movement is already in way for endovascular or minimally invasive treatment, robotic, because still human beings are afraid of surgery and knives. So if you can do things with less invasive, minimally invasive, less painful way, then that is really a plus.
The system is intuitive surgical, and the instrument is called the Da Vinci SI. The premise for this is to be able to approach the heart through a smaller group of incisions or with no incisions at all. This is going to help with the recovery as well as the pain and discomfort associated with a thoracotomy or certainly with a sternotomy.
And with the refinement of all the surgical practice, that you can go to almost any blood vessel anywhere in the body and take care of them.
We're treating sicker and sicker patients with better and better results.
Bringing the TAVI graft to Albany Medical Center allows us to treat critically ill patients who would normally be allowed just to live with their disease and live a very short lifespan.
Probably a third of patients that have critical aortic stenosis currently are not treated. And so having this option, I think, will bring more people to treatment.
And not just any treatment, treatment by minimally invasive means, where a catheter is inserted from remote access sites in the body and travels through the aorta up to the aortic valve, where it's implanted by a team of physicians that specialize in the procedure.
And these patients are, per protocol, they do better if they're extubated early. So if you can try and extubate them and not put them on the respirator to begin with, they will do much better. Keeping that in mind, we have to choose the anesthetic agent very carefully.
One of the great things about the TAVI procedure is that it truly brings a multidisciplinary collaboration amongst cardiologists, cardiac surgeons, vascular surgeons, anesthesiologists, together to collectively take care of patients with complex problems that really don't have any other solutions for their critical aortic stenosis.
These valves are only in the first or second generation. The third, fourth, fifth, sixth generation of valves are going to be much easier to implant. The sizes and the shapes and the tubes that we're going to be able to put in patients are going to be smaller, and it will include a much broader range of patients, just not the inoperable patient, but patients more likely to be very high risk.
The overall minimally invasive approach to surgery is important because the patients that have vascular disease in general are very sick. They have a lot of medical risks, and the possibility of dying or having a major complication is measurable. So any kind of procedure that we can do to lessen the risk is going to be beneficial for the patients.
Welcome to the Albany Vascular Roundtable. We are excited to have a collaborative presentation that will focus on heart and vascular innovations. The Journal for the Center for Vascular Awareness is VAware. The journal is focused on delivering the message of vascular health to patients, to people, to healthcare providers, to all of us in different aspects of vascular who don't have all the connectivity points to what the comprehensive total vascular picture is. So the journal is focused on targeting peripheral arterial disease, aneurysms, veins, stroke preventions, carotid artery disease, all sorts of different types of disorders that affect different patient populations. But at the end of the day, it's all one and the same. It's all vascular health, vascular care.